The WHO is being urged to make respirator masks the standard for workers in all healthcare settings. This was reported by the BMJ and The Guardian, mentioning doctors, scientists, and public health experts have urged the WHO to recommend that healthcare workers wear respirators in every encounter in healthcare settings. Every encounter. Gone should be the days of wearing a medical blue mask because it is very leaky, and we should have days where we should be wearing respirators. Now, it hasn't been put in place. It hasn't been a recommendation that has been made by the WHO, but it is important to have these measures to make respirators a standard in healthcare settings across the world. Because as this advocacy moves forward, it argues that not doing so is scientifically indefensible and dangerous, as it would continue to expose staff and patients to preventable and potentially even lethal risk from pathogens such as SARS-CoV-2 or COVID. Around 50 experts have endorsed the letter. Wearing respirators should be the default, and the authors add that the WHO could recommend that governments and healthcare leaders establish criteria for when respirators need not be used. If we didn't have pandemics and we didn't have viral pathogens, I think that would be the case. But I think respirators should be used in all public indoor settings, especially in healthcare settings. Because as they even say, we are deeply alarmed that the WHO continues to support policies allowing healthcare workers to wear surgical masks or no respirator protection at all when caring for patients. And while current WHO guidance recommends that healthcare staff wear a respirator or a medical mask when caring for patients with suspected or confirmed COVID-19, it's also important to just wear a mask in general, a respirator at all times, to just protect everyone, because you could be asymptomatic. That's why they mention below, they take their position that we should request what we really think is necessary. Airborne transmission has been overlooked from an infection prevention and control perspective, and that's despite ongoing transmission of COVID, epidemics of influenza or flu, and RSV. A cultural shift toward the practical acceptance of such measures and the lack of stigma seen in Asian countries, for example, accompanied by other interventions, could radically improve public health and profoundly reduce the pressure on the NHS both during the winter months and throughout the year. And the letter continues that the WHO has a responsibility to stand against misinformation and to ensure that public health advice remains evidence-based and for the benefit of all. Just look at the coverage for a regular medical mask and compare that to how you can have a tight fit with a respirator. We have a lot of evidence that shows that respirators are more effective, and we need to transition to that more effective mitigation.